Hello, I'm Emma Howard and I'm joined by Dr Su Laurent, who's a consultant paediatrician at Barnet Hospital in Hertfordshire. Hello, Sue.
Hello, Emma.
I have a question here about a woman who's going back to work in 2 weeks' time and her baby still won't take a bottle. So she's clearly panicking and wants to know what she should do. She hasn't got much time to change that, has she?
Well, this is a common problem. I'm often asked this by mums. And obviously, if a baby's been breastfeeding well, that is wonderful. And it's wonderful and well done to this particular mum who's managed to keep going so well. But often the baby knows that what they want and they won't let you get away with it. And so there are two things that you can do really. One is just hand your baby over for 24 hours to somebody who hasn't got a breast.
And doesn't smell like mum.
Doesn't smell like mum. And that might be dad, for example, or friend, mother, whoever. And the other thing is that you can actually just go straight from breast onto a little training beaker. You don't actually have to use a bottle, and some babies will prefer to go for a little training beaker than for a bottle.
Now, not many people think of that because it's missing out a step, and often first time round you feel you have to hit all those markers.
Absolutely, but some babies never use a bottle. They just go to a training beaker, and that's that. But Brilliant. I think this is where you get. I mean, if your husband hasn't been hands-on until now. Now's his moment. Yes.
So really good advice to have somebody who just doesn't smell like you and hasn't got that shape there.
Yes, but it does mean you've got to not be there, because the temptation to crack and say, it's okay, I just can't do this, over to you, is huge if you're actually there. But if you're not there and the baby knows you're not there, then there's more of a chance of
You'd
switching.
probably have to sit down with your partner and plan it so that you can make them strong, especially if they're not as hands-on as in the past as they've got to be now.
Exactly.
So they've got to be strong and not crack and go, I've really got to hand this baby back to you because it's not happy.
Exactly.
And you think it could take as short a time as 24 hours?
I think so. It depends on how determined you are.
Very well then. So have a plan of action, be determined, and you could work it.
Exactly.
Oh, Sue, fantastic. Well, if you have a similar problem, we hope we might have given you some help. But remember, it's always best to go and see your own doctor for medical advice. Thanks for watching. We'll be back with more health questions and answers.